19-year-old John Doe was found dead outside of a restaurant in Hillwood City. Since the discovery of Doe's body, detectives have been working with the clues at the crime scene to determine possible suspects. After Doe's autopsy, it was reported that his cause of death was respiratory failure. Unfortunately, our toxologist is unavailable and we need your help to determine which poison was used. His symptoms include high blood oxygen levels, respiratory failure no more than 2 days before the body was discovered, no puncture wounds to indicate injection, pimply skin, and one eyewitness who noted that John was breathing heavily and vomiting a few hours before the predicted time of death. Before you dive into Doe's case, let's review some of the most common poisons: cyanide, strychnine, and anthrax. Strychnine comes in many different forms. Inhalation of cyanide is the most harmful and common, but cyanide can also be injected or absorbed through the skin. Stopping the production of ATP and inhibiting complex IV, cyanide restricts the mitochondria from producing O2 in the ETC and forces anaerobic respiration to occur. This causes tissue hypoxia, leading to an abundance of oxygen that the mitochondria cannot use to be stored in the vein. Strychnine is a white, odorless crystalline powder that mainly affects the nervous and muscle system as a potent convulsant. It prevents the proper operation of the chemical that controls nerve signals to the muscles. The chemical controlling nerve signals works like the body's off switch for muscles. When this off switch does not work correctly, muscles throughout the body have severe, painful spasms. Eventually, the muscles tire and the lungs cannot provide enough oxygen to sustain this activity, resulting in respiratory failure. Anthrax is a serious infectious disease caused by bacteria known as Bacillus anthracis. It affects the respiratory system in humans and is not contagious. Anthrax spores kill through the toxins released by Bacillus anthracis, and these lethal toxins target heart cells and muscle cells surrounding blood vessels, leading to death. It can take anywhere from 1 day to 2 months for the infection to set in, and without treatment it is almost always deadly. So which one of these poisons killed John Doe? Have you reached your conclusion? Our toxologist has come to their conclusion that it was dun, 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 cyanide! Good job, future toxologists!